Okay, I am here today with Krystle Howald, an orthopedic and pelvic floor physical therapist, and Amy Kiefer, a nurse, personal trainer, and influencer aficionado. And they're also the sisters behind Expecting and Empowered, a business on a mission to transform pregnancy and postpartum support for women. Thanks for being here today, guys.
Oh my gosh, thank you so much for having us.
Absolutely. I am so excited to get into it. Okay, so let's start at the top. Can you guys tell me a little bit more about the why behind your mission and Expecting and Empowered? Like, what do you notice is missing education, health, strength-wise for the population that you serve? What was kind of your reason for this, all of it?
Yeah, so Krystle and I were both really interested in prenatal working out before we started Expecting and Empowered. We both had certifications. Krystle went to physical therapy school, the whole thing. But when I tell you, when we went through the experience of being pregnant for the first time ourselves, that's what started the mission. Because we realized even with education and certifications, it is a lot for the woman's body to go through. And that's just pregnancy, let alone postpartum as well. So when we were going through pregnancy and looking around for a resource, we just couldn't find any that really covered, like, what do I do when I'm pregnant? So as the story goes, I called Krystle on the phone. I was on my way to the gym. I was like, I really feel like we should make something. I know we could make something better than what's out there right now. And that's how Expecting and Empowered started. And then once we started, it was our customer. Our customer said, you guys have to make something for postpartum women because that is equally as confusing. So really it was our own experience of going through it ourselves and just deciding, you know what, women need way more information. I know you've been following us for a long time. I would say Krystle was one of the first people on Instagram that would really put on like a vagina costume and just nothing was too, everyone always says TMI, TMI. We were the women that were like, nothing's TMI. People need this information. Otherwise, they're not going to heal correctly. And there's long-term impacts, as both of you know, to that. So yeah, we feel like we were ahead of the curve and we're still doing it. Just any question that anyone has around women's health, pregnancy, postpartum, it's our mission to serve that. And we give so much free information away just as you do.
Yeah. I also feel like, too, there's a huge component where it's like normalizing things that even though we're women and we're all going through it at the same time, it's like everyone's scared to be like, did this happen to you? Or is this normal? Or like even asking your OB about stuff, or anyone. It's like, I think you guys have really done an amazing job of, and some of it through humor, but normalizing that like you're not alone and it's okay. And you don't have to live like that for the rest of your life. And that's a piece we'll get into too, where I feel like you guys do so much education around common versus normal, and that even though so many people commonly experience this, it's not normal and it doesn't have to be that way, But I love it. Okay, so let's jump in. Krystle, tell us about the pelvic floor. When you think about what regular person doesn't understand going into pregnancy and postpartum about the pelvic floor, like what is the first thing that would come to your mind that you're like, I wish I could say this. I wish you understood this piece.
Well, if you think about it, it's just a part of the body. Like every muscle needs strength training, flexibility. The pelvic floor obviously is a little bit more like taboo because it is your private. So people think of it like, oh, you shouldn't do Kegels. You should do Kegels. You guys, it's literally a muscle just like any other muscle in the body. And most people just don't look at their pelvic floor or like know what it's like. So honestly, it's just a bunch of muscles. Like think of your pelvic floor almost like a basket at the bottom of your pelvis. So this basket is helping to support our bladder, our uterus, our rectum. So obviously it helps control pooping and peeing, but it also helps stabilize this area in our body, which during pregnancy and postpartum can become unstable And that it obviously does play a huge role in sexual function. I just worked on like a 50-year-old lady's pelvic floor, and now she'd be popping off in the bedroom. And that wasn't happening before. So it is throughout our lifetime. It's not just like, hey, I do think it does shine like a strong light on it when you're pregnant, because all of a sudden you're like accidentally peeing yourself. That issue probably was there, but pregnancy is just amplifying the problem.
Really. Okay, so when it comes to pelvic floor therapy, do you feel like that is something that everyone would benefit from? Or is that something that you're like, this is really the time that you should be coming in? Not obviously we're all about prevention rather than reactive care, but in general, is there something you feel super passionate about in terms of who's coming for pelvic floor therapy?
Well, I do love preventative care. So when anybody's pregnant, I love to see them when they're like 20 weeks pregnant, 30, 36. In that session, we're doing a lot of like almost undoing, which is kind of cool too, because I've used the clinic seeing patients. I literally just figure out what's going to happen to people's bodies. It's very predictable, right? During pregnancy, our abs are going to slowly separate and we're going to lose tensile strength in our abs. So in the pregnancy guide, we work on staying connected to our core. People will get really tight in their rib cage and their trunk. So then I see that in the clinic. Then in the guide, we like work on that and use research. That's why your neck is like chronically tight. So you definitely want to be coming in during pregnancy. And then postpartum, I will say, I feel like it's really hard to get women to take the time, because everybody's like, okay, maybe I know I should be coming in for pelvic floor physical therapy, but it's like, I'm honestly only dribbling a little bit of urine every once in a while. But as we age, just like every other muscle in our body, it's going to get weaker. So taking care of yourself postpartum, the first 2 years, the more you can do right away, the better. But there's always stuff you can do to kind of hit the Control Alt Delete button like longer on. So like if you didn't take time to do it, you should take time later. But it's so good when you just do it right away, because it's such low hanging fruit. It's, it might take me 1 to 3 sessions to help somebody get on a good pathway, versus if I see them like when their kid's 10 years old, it might take us like 10 sessions, 12 sessions, and then we're constantly reteaching the brain better strategies of doing things. So it's so much easier right away.
Yeah. And have you seen in your experience, like, as long as you've been doing this, any shift in accessibility related to pelvic floor therapy, or referrals, I should say, at that point, or preventatively? Or do you feel like even still that the bulk of the people that are coming to you are people that have an issue and are now like, all right, I guess I got to do something about this, versus being like, I don't want to have to do something about this, so I'm going to ask for a referral, or I'm going to hope an OB refers me, kind of thing?
Yeah, I do think some, like Amy's OB that she had when she was pregnant, like was giving out expecting and empowered and telling people to go to clinics. I do think, one great thing about being on social media or podcasting is you can teach women how to advocate for themselves. And I do think with all healthcare, you just have to be a strong advocate for yourself. So our OBs being like, you should be going to PT, maybe most of them aren't, but it's like, you're asking your OB for the referral. Sometimes too, like even in our clinic, it is out of pocket, but I would rather spend money here than spend a bunch of money at Target that that's like gone in a little bit, or you're like decluttering and the things that you just bought are leaving. So it is just advocating for yourself. But I do think it is getting better with education.
Yeah, yeah. And I feel like too, part of the really powerful part of your in-clinic work, and like you said, that carries over directly into your app, and the way that you guys have developed the support that is, and education that's within that, is really incredible, and really speaks to the fact that things are ever shifting in healthcare. So if we can get ahead of it and have, if someone is feeling nervous about going or embarrassed about the symptoms they're experiencing, having something where you can be like, okay, I can do this from the comfort of my home, look through this and work through it at my pace in a way that works for my season with a newborn or whatever. I think that is so powerful. But I think in general in healthcare, we have a long way to go in this country in terms of prevention instead of reaction, So is there some sort of resource or spot where someone can go to and look to find a pelvic floor therapist in their area?
Yeah, on expectingandempowered.com, we do have a providers map. So if you just click at the top too, it says find a provider. There's like a lot of amazing physical therapists. I do think of it as like a little army of people just trying to help everybody else out and like lend a hand to the women behind us. But there's some really talented people. So you could click on that and find somebody in your area. If there's nobody on that site that's in your area as well, too, I often think like community resources are amazing. Just popping in a local mom's like Facebook group, like, hey, I'm interested in doing physical therapy. Does anybody have suggestions? All the time in there, people are listing the best people in your area to do physical therapy with. So sometimes using those, and then too, I feel like honestly, just like typing in physical therapy and then those Google reviews come up. Most people that are really good have a bunch of the Google reviews.
That's awesome. And we can also put a link to that in the episode notes as well. So we'll have that set up that people can just click right on that and find someone in their area. Okay, so let's head into, before we talk really about, I think the really important piece, although this is all really important too, but the really important piece that I know Amy and I have talked a lot about is really the mindset of a mom when it comes to exercising or prioritizing ourselves in general. But before we go into that, I would love to just talk a little bit about labor and delivery method, because I feel like oftentimes the method of delivery is a big part of your recovery, but also like what the rest of your life looks like, what your exercise looks like, what your strengthening looks like. So is there anything that you feel is really important for people to understand when it comes to a C-section delivery versus a vaginal delivery in terms of pelvic floor and pelvic floor, the impact on pelvic floor, the impact on being able to get back into exercising or prioritizing movement, that sort of thing?
Yeah, I think they're actually very different as far as the recovery. There's obviously some similarities on how you recover, but if you think about the method of delivery, they're very different, right? A C-section, somebody is actually cutting through 7 different layers of your tissue. So with that, there's a lot more abdominance. Your back will take over. Like C-section moms often feel a decent amount of back pain right away because they can't really be using their abs. So it's like we do have to retrain their brain how to reintegrate that core and their abs back into it. And then a vaginal delivery, often there is some tearing. Most moms will have like a grade 1, 2, 3, hopefully not a 4 tear where they're tearing the vaginal wall somehow. And then there's scar tissue there too. So often people talk about getting the scar moving on a C-section mom, but they don't talk about a vaginal mom. So if you think about it too, like if you're making your bed and like one corner of the bed is like really tight, you can't pull the bed to the other corner because it's really tight. The same thing happens in your pelvic floor after a vaginal delivery. If you tear, tissue will pull to one part of the like the pelvis, and so that's where sometimes people have painful intercourse. They're starting to get prolapse because that whole bowl, not everything's working equally. We want to like restore some of the symmetry in somebody's pelvic floor. Often moms that have had vaginal deliveries too, they do have a lot of dysfunction higher up, like mouth, TMJ, jaw dysfunction in your thoracic spine. All these things are linked together. I treat the pelvic floor and I'm very happy to treat the pelvic floor, but I think there's a lot of different areas that get affected from childbirth that we don't think of that are high up or lower down, like even your feet after having a C-section and or a vaginal delivery, your feet could be really tight because again, all that scar tissue is pulling on one foot. So then all of a sudden you're waking up in the morning and you look like Captain Morgan. And that's not like thing. You just got to get these areas to do their own job.
I think that speaks directly to the piece too that we've talked a lot about behind the scenes is that it's not just about the area that we so commonly think of, right? Like it's not, we can feel that we have no abs, you know, like that feeling when you wake up from delivering your baby and you feel like everything's going to fall out of your body, like that leading directly into then you're picking up your baby, you're nursing, or you're feeding them and you're hunched over. And now all those other areas that I didn't even realize were already impacted just from the delivery method are now even more so, especially if there's like underlying asymmetries or scoliosis or whatever it might be, you know? I think we often forget how connected the body really is. But yeah, wow. Okay. Can we talk about how to really know common versus normal? Like, is what you're experiencing normal? And at what point do we need to be aware of our body so that we can adjust exercises or adapt or not just go full force into trying to get back into running or something like that? Like, really being able to kind of assess your body. And I know your app has parts of that, but I would love to hear kind of your thoughts on that.
Well, I feel like a lot of things are chalked up to being like, this is just normal after having a kid. So maybe too, it's helpful if I just go through some things really quickly, like some bullet point highlights, like peeing, any type of urine, whether it's a drop or a lot of urine, peeing is not normal.
Peeing is normal, like, because you would pee.
Yes, sorry, like
No, you're good.
involuntary losses of urine, peeing, or incontinence when you're losing urine. And then, um, same thing with pooping, right? People like don't talk about this a lot, but if you have to wipe multiple times when you're pooping, I love like a healthy pelvic floor. You just got one nice clean wipe and then you're off and doing your other things. But having to wipe multiple times or hemorrhoids is a pressure problem. We shouldn't have hemorrhoids. Even if you have hemorrhoids, we can decrease hemorrhoid symptoms by doing a few simple things. Most women will have their tailbone like tucked underneath us. So learning to expand in this area, like a tucked position is almost like, when an animal's like, oh, I peed on the rug and they're so sad about it. Like you're like a little bit more scared. So your tailbone is tucked. That happens a lot with women. So we want this big expanse of big butt energy, like just let that area be free a little bit, have balance side to side. So any kind of pressures down there, which includes hemorrhoids, also having hernias. Like a lot of times I'll catch these in the clinic. I'm like, how long have you had this hernia? And they're like, I just thought that was like normal after having kids. I was like, no, your belly button, that's like your organs. I can see them by your belly button. So hernias are something that's not normal and that we can like do a lot to correct with. And then again, like those aches and pains, like you don't have to have back pain after you have kids. You don't have to have one-sided hip pain. You don't have to have a hamstring that's irritated. You don't have to have the Captain Morgan peg leggy thing. You don't have to have that chronic neck tension. Like I see so many moms like cracking their neck all the time or like rubbing this upper area. Those are things that we all want to work on like fixing. So those are things that are common, but not normal.
Yeah, totally. And even like post epidural pain was not something that I had heard at all about until I started experiencing it. And using your app is really the only thing that helped me with that. But when I finally actually shared about my experience with it on Instagram, the amount of people that were like, that's what that is. I have that too. Like, obviously, part of the bigger conversation about just not having people always being willing to share about what they're experiencing postpartum. But I think that educational piece that you guys bring to it is so important, because if you don't know and you don't know and you think it's normal or that's just your life now. Okay. Can we talk a little bit, Amy, about really like the mom dilemma of how do I make time for this? Or, really prioritizing your own health and your own well-being as a mom and not feeling guilty about it because it lets you show up in a different way for your kids. What are kind of your thoughts around that? I'm sure you see a lot of it.
Well, yeah. I mean, and the thing is, we both went through it. I'm sure you went through it too. There's all this pressure, whether it's society imposed or honestly, for me, it was my own pressure on myself, especially as a working mom. I just felt so bad taking any more time away to do something like working out. And then for those of us that have gone through it, what we can tell you is it's a recipe for disaster if you're not taking care of yourself, not taking any time for yourself. Like we all know it's hard, and we can tell you if you don't, it's going to catch up with you. Like it absolutely catches up with you, whether it comes out as mom rage, whether it comes out as like not being able to control your stress, anxiety, or otherwise. So, but we've been doing this for so long now, like 8 years. So we've helped so many thousands and thousands of women get their workouts in. It was really important to us to make an app where it can be done from home. Most workouts can be done in 30 minutes. And so we really wanted to make it the type of thing that could really be done. So Krystle and I have been huge at understanding it's a time in life where sometimes your priorities, you are going to have to choose them. And I know I've heard you say before, like for some women, it's really hard to maybe walk past the laundry to do their workout, to walk past the mess to do their workout. So different things are going to work for different women, but we're big on like at the beginning of nap time, getting some movement or your workout in instead of doing everything else you have to do. Utilizing your partner. If you have a partner and they're able to spend time with your child, it's both of your child. Like they should have some one-on-one time with the children too. So utilizing your partner. Krystle and I were both huge on, we would really work out on the weekends because that worked better for our work schedules. You just kind of find what works for you. But as we've heard from so many people and experienced ourselves, if you're moving your body, the way that you're truly able to control your stress, your anxiety, you're feeling like if you're down, you're feeling blue, it really, really helps and it really matters. And I know it's so hard, but I also know that it's more helpful. If you can just push through that and try to get some consistency in, it really matters for you and your mental health.
Yeah. And it's funny that you say that because as you were just explaining that, all I could think about was when I was postpartum and in the throes of what I didn't realize at the time was postpartum anxiety, but it was nearly impossible for me to give someone else my child, including Jay. And he's a wonderful father, but like I could not release that control enough. So using your app to be able to also shift my mindset from like, for me, it was always working out was always about really like aesthetics, right? Like I wasn't necessarily focused on strength. I wasn't focused on like, okay, if I do this functional movement, I'll be able to lift my baby up. I'll be able to do this comfortably. So also shifting from like, it's okay if you're not getting an hour of heavy workout in. If you
Yeah.
have 15 minutes and you're just moving your body in a way that lets you just get out of your own head and feel a little bit like yourself again, I feel like that's a huge piece that I think is really it's hard to see that when you're in it, but, like, it matters so much, you know?
Yeah, it's when before kids, for a lot of us, we did have more time to work out, right? That's just the truth of the matter. And after you have kids, your time demand is so high, your overall demand is so high. So, like I said, we totally get it, but we also really try to help people reframe what a workout needs to look like. When we were younger, did we want to go to the gym, be dripping sweat, be so sore, like have all those things? Like, yeah, probably we did, but we've become moms. Our bodies have transformed. Our program really helps you start a foundation. Like Krystle could talk all day about building on a foundation of recovery instead of we can't just jump into everything that we used to do that would not be safe for you to do. But then, as you were saying, it's also the mindset around it. We always tell our community, give yourself credit. If 15 minutes is all you could get in and you press play and you did 15 minutes, that's way better than 0 minutes. That absolutely counts. We added a pause button into our app because we know that life happens. Your baby cries and then you have to go help your baby. Like,
Yeah.
absolutely. That's what all of us are going through. But just to try to make a really safe, healthy community of people that give themselves credit for anything they can get it.
Yeah, absolutely. I love that. And is there things that either of you, feel like would be helpful for any mom to hear that, like, if you can't get this in, do this one thing, whether it's a 10-minute walk, whether it's, a specific exercise to help target laying a stronger foundation or recovery after pregnancy and postpartum. Like, is there something that you feel is like you wish every mom could just implement into their day at some point? Or is it just movement in general, any kind of movement that you can get in?
I mean, I am like the woman screaming from the rooftops that strength training is so important. Like I think a lot of I mean I'm totally down for the walks and everything like that, but just over the course of a lifetime being able to recover from having a baby, then also we're going to start aging, and I just think that strength training is truly the foundation of being able to get through all of these seasons of life, especially if you have a good plan.
Yeah. And now if you're a mom that, let's say you're listening to this and you're pregnant and you've never strength trained before, having an outline to say this is what's safe to do right now and feel confident in that rather than being like Googling a workout, doing it, and now you end up with diastasis or whatever it might be because you just didn't realize that it wasn't safe, but you want to be doing something. Like, I feel like that's really powerful too.
And I think especially during pregnancy too, you can do a lot of things. And then too, they tell people like, just listen to your body. Well, people that were athletic and are athletic, you usually learn not to listen to your body. So I feel like
Yes.
before we did Expecting and Empowered, my first pregnancy, like I was competing with the 50-year-old next to me to see who could lift heavier and do lunges. I was doing like the right things and I was like strength training at a really functional gym that's actually really good. But I also wasn't supporting my body for what was like going to happen during pregnancy and then during labor and delivery and then postpartum. So I do think like, it's like almost like how you were talking about, Casey, like reframing like what a normal workout or the intensity looks like. I also think too, it's if you really like zoom out, it's like such a small period of life where you might have to adjust things to working out. Like I just had a patient in the clinic a couple weeks ago and I was like, dude, I was like, I will let people do whatever they want unless I think it's going to be dangerous. And I was like, you have no business running. And she likes to go to a gym where half of it is running and half of it is weight training. And I said, I wouldn't do that if I were you. And then over the 4th of July week, she's like, what is this? I was like, it's a picture of your groin torn. Like her whole groin was like torn from just running on the treadmill. So it wasn't like she was doing anything crazy or intense. It just was like you didn't have the prerequisites to be doing that. And, her kids are older too, but she never took the time to relay the initial foundation. And can she like do it? Yes. She's like postpartum. She physically obviously was running. It doesn't sometimes come at a cost like that. And then it's hard now because then you got to rehab that whole thing and then relay the foundation. But I think sometimes just supporting your body. So like, again, zooming out, thinking like, hey, this is just a small period of my life where I just have to do things a little bit like correct or support my body and it will pay dividends in the long run.
Yeah. I think it's funny that you say the running thing because for me, I was always a runner and I I went back into it way too early because I like needed to prove it to myself that I could run again. It didn't end well. And I was like, let me go into my Expecting and Empowered app and look at the running program. And I did the full assessment on myself. And it was things that, like, even as a physical therapist with an understanding of the body, I know I have scoliosis. I know I have asymmetries. I know I went into pregnancy and postpartum almost at like a disadvantage, if you will. And I still didn't think to myself, like, Case, like maybe you're not ready for this. It's okay if you start with like an incline walk or whatever it might be. But for me, it was like I needed to prove to myself, like, oh yeah, my body just went through all that and I can still do this. And I think that, especially for people who were athletes or who really worked out hard before pregnancy or postpartum, I think it's really challenging to like actually give yourself that permission until you make a mistake and do something that you're like, "Ooh, I probably shouldn't have done that." And now you're in rehab or, you're faced with the fact that you have to do something about it. It can't just be like, let me try. Yeah.
It's tough. I do always joke in the clinic too, because some of our easiest, best patients, they're all like middle-aged males that sit at the computer and are just, and doing investments or doing their business thing. And then they try to be like golfers. All I have to do for them is get them moving. It's kind of like annoying and unfair. Then you have these postpartum women and then you have to they have to buy into it and they have to I can't fix them necessarily by myself. They have to spend the time doing what they should be doing, which to me is kind of annoying, to be honest, because it's like, how come
Yeah.
it's not role reversal here sometimes? Because
Totally.
it's
After everything we've been through. Go
Yeah.
ahead, Amy.
yeah.
Sorry.
I feel like women are just honestly fighting for their sanity. And so maybe running to them was just something that they clung on to as the way that they tried to help themselves and help their stress level. And they love it so much. Krystle and I totally understand that. Like, we deeply understand that. So, working with our community and trying to get them to understand, like Krystle was saying, it's a short period of time that we're asking you to slow down or have less impact or to work back to this. It's not forever. It's just a short time, but it's a really important time.
Yeah. And I feel like that's a very challenging thing to like accept, but it's so important, you know? Yeah. Yeah. Okay. All right. So I think we've gotten through everything we were hoping to talk about related to pregnancy and postpartum and exercise and really finding that peace and that sweet spot for you as a mom to really be your best self and headed towards the things that you want to be doing again for you while in a season of kind of shifting and changing and it not looking like it used to, basically. But is there anything you can share with us about where people can find you, where they can get access to your education, your app, all of that stuff?
Yeah. So we are expecting and empowered everywhere. And we have more resources than I can even tell you guys about. So on Instagram, that's a big one for us. We're over there every day giving out free information. Expectingandempowered.com is where you can get our app. Casey has a discount code. It's Casey10 to join in. We also offer a free week. So that's really great. And then we also have a podcast. So the Expecting and Empowered podcast, where we have episodes just like this, where we talk to other people, but then also give a lot of our knowledge out into the world too.
I love it. And as someone who has used their app for almost 8 years now, well, actually it was the and now we've transitioned into the app, but through literally 3 pregnancy and postpartum periods, like it is worth every single penny. So thank you guys so much for all that you do and all that you provide education and information wise for us mamas that are going through it. And I will put links in the show note for you guys so that you can easily find all of their information and get set up too.
Thank you so much for having us on.